Good evening, Dr. Perry.
Hello, Sabrina. Thank you so much. Good to see
Well,
you and welcome everyone.
we have our slides of our preventative exams that you'll be discussing.
Awesome. So Sabrina talked about some really important things to keep our heart healthy, but how do we know if we're on a good path or not? So just like we have grades in school, sometimes we need some feedback to know how we're doing. So know how if we're heading towards health, if we're heading towards some things that would make us unhealthy or lead to further consequences. And so we do recommend an annual physical. So coming in every year to see us, to make sure we're staying on top of your health, make sure we're meeting all of your preventive guidelines. There are some things that contribute to your heart health that we can't change. So we can't change your age. We can't change, if your mom had a heart attack, if your grandma had a heart attack, those are things we can't change. But there are things that we can change. So we can change your blood pressure. We can change how you're eating. We can change some of these other things. And so that's why we call them modifiable risk factors. And so in the list there is all the things that we know contributes to an unhealthy heart, and we know that we can help you to lead you towards a healthier outcome. So we recommend you get your blood pressure checked every year. The goal is less than 120/80. Depending on your age, sometimes for older people it's a little bit older. We recommend screening for diabetes in some certain populations. And you can see the numbers there of what's normal and then what is pre-diabetes, which means we're kind of heading in that direction, and then diabetes. We recommend screening for cholesterol. And we care about cholesterol because we know that people with higher cholesterol have a higher risk of a heart attack or stroke. And we want to prevent that for you. And so we can't fix what we don't know. And so that's one of the reasons why we recommend coming in for regular blood checks so we can see how your cholesterol is doing. And then weight. So weight is an important thing too. And if you're tall, then you might weigh a little bit more. And if you're shorter, you might weigh a little bit less. And so that's why we take into account your height versus your weight, so your BMI. And we help to determine if you're at a healthy BMI or if you're overweight or obese. And all of those are risk factors that contribute to heart disease. So those are some of the things that we are able to do for you here at Cucamonga Valley Medical Group. And thank you so much, Sabrina, for allowing me to participate.